BPH is a common condition in older gentlemen that can result in symptoms of urinary obstruction. It is commonly treated with medication, and when that fails, surgery. Prostatic artery embolization, or PAE, is a new, minimally invasive alternative treatment for the symptoms of BPH. The prostate artery embolization procedure is performed by inserting a small catheter into the arteries that supply the prostate. This procedure is typically performed by an interventional radiologist who uses X-rays to guide the catheter into the appropriate position. Once the catheter is in the desired location, tiny beads are injected into the artery, which are carried by the blood flow into the prostatic tissue. These beads lodge in the tiny arteries supplying the prostate, significantly reducing the amount of blood flow the prostate receives. The prostate typically gets blood supply from prostatic arteries which arise on both sides of the pelvis. So once one side of the prostate has been treated, it's important to treat the opposite lobe. In this example, we started by treating the right side of the prostate, and we will now insert our catheter into the left prostatic artery in order to treat the left lobe of the prostate. It's important when placing the catheter to advance beyond the origin of any vessels that may supply the bladder or rectum in order to prevent accidental injury to these organs. Once both sides of the prostate have been treated, all catheters are removed from the patient. After the procedure, the patient is given anti-inflammatory medication and pain medication in order to limit any discomfort which they may experience. Over the course of the next several weeks, the reduction of blood flow to the prostate will result in the prostate shrinking in size. This will help relieve some of the obstructive symptoms by the BPH. The degree of size reduction and the degree of symptomatic improvement is variable amongst patients. As illustrated in this example, the enlargement of the prostate is significantly compressing the urethra. Once the embolization has been performed and the prostate has reduced its size, you can see the urethra is no longer being obstructed. If you are interested in learning more about PAE procedure, please visit our website at news.unchealthcare.org/heartandvascular/PAE.